Thank you, Chairman. Good afternoon, everybody. A few years ago, I've been to San Francisco as a tourist, and I met this tourist guide who said, well, this is my city. I love it, and I want to show it to you to share my love. And it's about, not the same, but quite close to what I'm going to do now, and I thank the organizing committee for inviting me to share with you this fascinating area of assist devices. I will talk a little about present, mostly about future devices and ideas. Question is, what are we looking at in the last few decades and in the near future? Are we talking about improvement, evolution, maybe even revolution? And we will see a little of everything. I will show you about the miniaturization, not to say revolution, but improvement, certain mode of action, what we call different generations of VADs. I'll talk a little about new ideas and technologies. I will talk about concepts, either partial flow pumps or total artificial hearts concept, and TET, transcutaneous energy transfer, which is probably one of the most important issues of future devices. There will be most probably some, or maybe a little more than some, overlapping with the previous presentation, but from different point of view. Now, we talk, for our convenience, about short-term bridge or bridge-to-bridge, extremely short-term devices, I would say, or call them ICU devices, not things that people can walk around with. It could be inserted or implanted surgically or percutaneously. The historical 25 years old Abiomed 5000 is no longer around us, and so few others will be not around us. This was a pneumatic device that could serve with two pumps. It could serve both ventricles for each atrium and ventricle, sort of, that were activated or pumping blood pneumatically with a big console. And then what Dr. Medallion showed to you, the Levitronic Centrimag, which could be either right, left, or biventricular device with a centrifugal pump, but still tubes coming out of the skin, connecting the patient to the environment strictly without being able to move. The tandem heart and impeller that are inserted or implanted percutaneously, you saw already. Now, as for the long-term bridge or destination therapy, you may see many that were presented before, the pulsatile, axial flow, or centrifugal pumps, and you may see that all in all we have 16 different vendors, companies, on this presentation slide, and there are a few more, and for each there might be more than one generation of device. So all around us, maybe in action or in improving or whatever stage, we might see some 30 different devices. So this tour starts for me something around 30 years ago with the thoracic pneumatic BiVAD that you may see is a cumbersome, complicated, not very elegant, not very nice device, but it was used to be very effective for biventricular support. Results used to be quite disappointing, with some between 50 to 60% 1 year survival after implanting for bridge transplant patients. Now, this is something to show you about generations, different generations of those devices. The previous ones, probably at the age of this thoracic biventricular device, were the HeartMate XVE and the NovaCore, which, and here I'm not sure you see the, maybe you see the figures, more than 1 kilo each that were still inside the body, and the patient did not have to walk with the tubes like the old thoracic thing. but still very heavy devices with high percentage of complications. The second generation were either the Berlin Heart Incor or the HeartMate 2 that weighs in the range of 200 to 300 grams, and now starting to talk about the generation meant the axial flow pumps. Those are the more old pumps. And now the third generation, which did not make the machines or the pumps smaller, maybe even a little bigger with 300 to 400 grams, but the mode of action became centrifugal. And now when we thought that something is growing up there and things will improve further, now the next generations were combining. One company that used to manufacture axial flow went for the next generation with centrifugal, and the hardware company that started with centrifugal pump went further. The next one is a axial flow pump, but still they call it fourth generation because they became smaller in the range of 1 to 150 grams of device. And now one company got clever and called this a fifth generation, which is not really true. Now, the miniaturization revolution is not a real revolution. Things became smaller and smaller, and you see this future hardware MVAD that is inserted into the heart, which is already what I will show in the next slide, what another vendor called Jarvik is doing. But the pumps become smaller and smaller, and I'm not sure you can see the diameters here, but they are running between 20 something to 17 millimeters in diameter. And here are the Jarvik generations coming down from 26 millimeters wide to some 12 millimeters for what they call infant heart. So we talked about miniaturization and mode of action. The generations actually were some kind of expression for modes of action. Now what about new ideas or technologies? There are some old and new. The Assist 5 of Heart Assist is not really a new concept. It is the same small pump with tubing which is a little different and some flow measurement device attached to it. So it's something new but not really different. Now a few years back, a company named Pulsecut used the intra-aortic balloon pneumatic concept to activate a small chamber that works actually a little like the impeller, but it was pneumatically driven. So it was a new idea. Another company called Sunshine Heart is using the same pneumatic patent to drive an intra-aortic, or actually should be called extra-aortic balloon pump, with something wrapping the ascending aorta and giving some good results so far with pigs. And I think they had first or second case first in man. Now, what next? Partial flow concept. Partial flow concept, talking about intermax, should be applied for patients in the low numbers, in the high numbers, sorry. So, Dr. Medallion talked about intermax 3 and 4 as a ideal or best candidates to apply a assist device before patients are coming down and organ failure begins. We are talking about early stages, let's say new heart stage 3. Nobody is running to put devices or pumps in stage 3 patients, but some called it stage 3A, and they said this patient may be stabilized in a current position with a pump called the Synergy Circulite system, which is a very, very small pump, the size of a 2A battery, that is connected to the subclavian artery and pumping blood from the left atrium. Okay? And then this pump, giving like 2.5 or 3 liters flow per minute, can support partially the failing heart and enable the patient to perform regularly or have reasonable life quality. The other concept is the total artificial heart concept. Nowadays we're talking either total artificial heart or biventricular support as solutions for a biventricular failing heart. The old one, the CardioWest total artificial heart, actually the first models came up in the early 80s. And actually from the first prototype that you see here and what we call today the SynCardia is actually quite similar. Two chambers connected and getting these attachments to the atria and these tubes going to the aorta and pulmonary artery are not much changed in the last 30 years. And actually today it is still a solution that is chosen by some centers, for example, the Benison Medical Center, and they chose this solution for total artificial support, total heart support. The other solution, and of course there are a few more devices, but not those, they are not really successful commercially. The AbioCore and the BivaCore, which is actually just came through and with a very few implantations. And the Karmat that took 2.5 months ago took the titles in the media. Patient, I think 2 weeks or 10 days ago, just died, but they did make it for 2 months, which was the first go. Now the other concept of total heart replacement therapy is actually the BiVAD, and this requires small devices. As you may see here, with the solution of hardware, 2 devices, one stuck into the left ventricle, the second one into the right ventricle, and the tubes are going accordingly to the aorta and the pulmonary artery. And this is a viable solution. And when we wanted to go for it, we actually, for reasons that I will not go into, we had to end up with a ventriculectomy, bilateral ventriculectomy. We had to remove the ventricles, and we connected the heart with pumps directly to the atria. So now you may see here what looks like the tricuspid ring, tricuspid annulus, and the mitral annulus. Okay, each is the rings of the VAD are sewn to it, and then into the rings we put in the hardware, and the result is fascinating. This is Tali. She's how much, Jay? Like 9 months? 9 months post. You may see that she does carry both bags for the controllers and batteries, and she's active. She is now just won a prize for a volunteering officer, a police officer in the Golan Heights, and she is really active and doing quite well and waiting for a heart. Now this I will not talk about, since genetics and the other stuff are not familiar for us, and definitely not in the near future. But still, we have something that everybody, including Dr. Amir here, that saw many patients and followed many patients with VADs in his fellowship. It's a common desire of all cardiologists that are following up patients with VADs. Give us wireless solution. Okay, those wires that traverse the skin are really a nasty thing and a source of infection and a source of frustration for everybody. Patient is connected to something outside of the body, and I guess that this is near future solution that is really mandatory. The ideas came many years ago with those AbioCore and Aero Lionheart, which never took off, but you see those patches inside subcutaneously, and they dreamed of outside patches that will transfer the energy to the body in a manner which is quite familiar. And now they can charge mobile phones, okay, with magnetic fields. The pump requires quite a lot of energy, between 7 to 10 watts, to operate the engine. But there are solutions. Solutions are coming. Hardware company works with a vendor called Dualis Medtech, which was part of the European Space Organization and became a separate commercial vendor. And they try to work in the same manner that was attempted before in the last 20 years. Hopefully, they hope that they will succeed in creating transcutaneous energy transfer with a subcutaneous patch, and outside of the body, not to stick anything on the skin, to wear some kind of a underwear that will include the transfer system. So it is a TET, transcutaneous energy transfer solution. They estimate that they can supply the demand. It is alignment sensitive, meaning that when you have a subcutaneous patch, you have to put your outside patch quite at the same place. Tortec, their potential cooperation is with Whitericity. It's a company that did work a lot for supplying energy for laptops, speakers, and other stuff. And they dream of some big coils outside of the body, either in the room that will charge the patient somehow. I'm not sure whether they are successful or not. And there is a company, Israeli company, which I know something about, which is trying to push into the market. This is myself, right? Okay, so this company is working with an external belt which carries the battery and the controller, and this belt is supposed to transmit a magnetic field with enough power to operate the inside system. So the outer part is like a belt, and of course some remote tablet for the doctor and some watch, and inside there will be the VAD and some receiving coil and internal controller and battery. The receiving coil should be look like this or something else. And of course, whenever we talk about that, we show this slide, and you can read. It's a bit tricky to think of a wireless solution, but for the summary, we definitely think that smaller yet highly reliable devices, minimally invasive surgery that I did not speak about but is underway, and wireless technology probably will enable us to use future assist device earlier, and maybe as early as the time of acute heart failure event. Thank you very much.